Thanks for joining us for KSAT News at 9, streaming right here in the KSAT 12 newsroom. I'm Courtney Friedman. Coming up tonight, an update tonight on the local team working to create a portable ventilator. The San Antonio airport getting millions of dollars in relief funds. Plus, we'll be joined by an infectious disease expert to answer your COVID-19 questions. But first, the latest numbers. There are 21 more COVID-19 cases in Bexar County tonight, bringing the total number to 815. 312 of these patients were infected through close contact with a person previously infected. 268 cases were contracted through community spread, 169 are travel related, and 89 patients are hospitalized. 38 of those are on ventilators. The death toll stands at 33. 141 people have recovered. Among the new confirmed cases, 6 additional inmates at the Bexar County Jail have tested positive. This brings the total number there to 8. Bexar County Judge Nelson Wolf says he expects more positive cases at the jail to be confirmed soon. He also says they're trying to prevent the spread as much as possible, protecting inmates by doing things like identifying medically at-risk patients or people who may have been exposed, increasing hygiene efforts, and expanding testing capacity for symptomatic inmates and staff.
So while our numbers are low, we expect to continue to have some issues at the jail, and we're taking all the steps that we can reasonably take with respect to stemming the tide of it.
In addition to the inmates, 14 deputies, 2 civilian employees, 1 Bexar County facilities maintenance employee, and a UHS nurse assigned to the jail have also tested positive. When will San Antonio reach its peak? It's a question we've all been asking, and now we're a little bit closer to getting the answer. During tonight's City and County News Conference, Assistant City Manager Dr. Colleen Bridger said beginning tomorrow, Metro Health will post on its website 4 different models projecting San Antonio's peak. These models will be updated as new information comes in. 2 of the models are from UTSA, 1 is from an international consulting firm, and 1 is from the University of Washington. The models all show different projections, with the peak happening anywhere between late April to mid-May. Bridger says one number they'll be keeping an eye on, though, is projected number of cases.
Right now, there's a pretty big gap between the smallest estimate, which is 1,100, and the largest estimate, which is 10,000 plus. So that, I think, will narrow in a little bit more as we get more and more data that we can feed into all of these different models and better understand what to expect.
And as for what the city will do with the data, Bridger says it will be used to help the city make data-driven decisions as they continue to respond to the pandemic. Well, they worked 14 days straight, but they got it done. An update on the local team working to create a portable ventilator to help with the potential shortage in our community. Take a look. That's the adaptable emergency ventilator that cost about $500 to make. Patty Santos tells us the team is now moving on to the next phase, testing.
But essentially, it's this squeezing motion that we're imitating.
It gives breath.
And there's been many examples in the past where this has been the last resort when you don't have a ventilator.
A manual resuscitator turned into a battery-operated portable ventilator for under $500.
I think we've covered all the bases, and we're certainly very, very happy about the point that we're in, but certainly we're not at the finish line.
The team, including District 1 Councilman Roberto Trevino, makers with Can Opener Labs, and specialized doctors, are inching the device closer to hospital beds.
What we need to do now is produce a dozen of these to hand over to UHS so that they can do the testing in their facilities and under their conditions.
The adaptable emergency ventilator, or AEV, will be tested by squeezing air into a mannequin with simulated lungs for days at a time. Their goal was use simple parts, make it readily available, accessible, and affordable.
We've designed this in a way that all the parts can be made, and even the battery packs and battery backups, we've purposely chosen parts that can easily be readily available within 24, 48 hours in volume.
The hope is that once testing proves its effectiveness, hospitals will pick them up for emergency use. The end result is to bring breath back into people's lungs and San Antonio.
So this machine, I think, is not only can save lives, but in a long-term effect, it can help recover the economy here. We can showcase what we're capable of, showcase companies what we can do.
Beyond the pandemic, they say the AEV could be a good tool for fire departments and ambulance staff because it would free up the hands of first responders while they continue working on a patient. For the 9, Patty Santos.
Thank you, Patty. As airport passenger traffic plummets amid the pandemic, the federal government is offering an unprecedented amount of funding. More than $800 million will be distributed across the state of Texas. The San Antonio International Airport getting almost $40 million in relief funding. Our international airport is clearly getting the most money in our city, but Stinson is getting $30,000 and Kelly Field will get $20,000. The funding is awarded to each eligible airport under a formula based on metrics like passenger traffic. Airports can use the funding to continue operations, including payroll, utilities, and debt payments. To see a map showing funding being given to more area airports, you can just head to KSAT.com. Let's take a look now at COVID-19 cases in our surrounding counties. Kendall County seeing an increase in cases with a total of 14. Comal County also reporting an increase with 39 confirmed cases and 6 deaths. Hayes County now has 103 cases. Guadalupe County lists 51. Meanwhile, Atascosa County has 9 cases. Medina with 13. Wilson reporting 11. And Bandera County now has 2 cases. Zooming out even further, Texas now has 14,000 cases and 318 deaths. The U.S. has about 603,000 and 25,000 deaths. Globally, there are more than 1.9 million cases and 125,000 deaths. Let's turn now to the 9 at 9. The death toll has gone up after multiple states were hit by tornadoes. A new study shows long-term space travel could permanently damage astronauts' brains. Plus, a look at how COVID-19 is impacting communities around the world. Here's tonight's 9 at 9. The death toll from the storm system that rolled across the south and up the east coast is now up to at least 34. Severe weather spawned at least 40 tornadoes. Now, states already grappling with the coronavirus pandemic are trying to recover from the storm's impact. Some shops and businesses in Italy were allowed to reopen today. Among the stores to reopen, clothing stores for babies and children and bookstores. The new decree says any store that reopens to the public must respect the rules. For example, making hand sanitizer available and enforcing the use of masks in closed spaces. Some U.S. farmers are destroying their crops over a lack of demand from restaurants that have become takeout or delivery only. Some dairy farmers are dumping fresh milk that would normally go to schools that are now closed. But the American Farm Bureau and Feeding America want to get those wasted products into food banks. They're proposing a voucher program that would let farmers and food banks work together directly instead of going through a third party. Former President Barack Obama has officially endorsed Joe Biden for president.
Joe has the character and the experience to guide us through one of our darkest times and heal us through a long recovery.
The halt in demand for air traffic amid the coronavirus pandemic is having a staggering effect on Boeing. In March, customers canceled orders from the aircraft maker for 150 jets. According to the company's CEO, Boeing is now offering buyouts and enhanced retirement packages to employees as it attempts to limit the need for involuntary layoffs. South Korea is sending 600,000 COVID-19 test kits to the United States. The country's ability to test large numbers of people in short periods of time have been seen as a major contributing factor in its success in combating the virus. Ticketmaster is facing backlash over its refund policy. USA Today reports that previous wording on Ticketmaster's website said refunds were available for postponed, rescheduled, or canceled events. The wording has been changed to state that refunds, quote, are available if your event is canceled, end quote. Ticketmaster said they merely changed the wording, but that the policy on postponed events has remained consistent. According to a new study, long-term space flight could permanently increase an astronaut's brain volume, and that's not a good thing. The findings of the study also indicate that the effects can include a deformation of the pituitary gland. The study's lead author says microgravity causes blood to redistribute towards the head instead of pooling towards the lower extremities, creating more pressure on the head. A 97-year-old great-grandmother defeats the coronavirus in Brazil. She is the oldest patient who has managed to overcome the disease in the country. The woman was admitted to the hospital on April 1st, presenting symptoms like cough and mental confusion. She has since recovered and was released from the hospital on Sunday. To read more about these stories, head to KSAT.com.
Good evening, everyone. I hope you've really enjoyed your Tuesday. The weather was absolutely beautiful outside. Started off chilly, ended up nice in the afternoons. We did have a little bit more cloud cover, though, than the last couple of days. And let's go ahead and start off with some good news, because we need some good news in today's world. The good news is oak season, well, it's starting to decline a little bit. In fact, today, the pollen count, oak was only at 390, which is moderate. And as you can see, we're kind of on the downslope of oak season. Oak season ends in early May, so we're almost there. Just gotta hang on a little bit longer. But other than that, yeah, it was a pretty cloudy day. At least during the midday hours, we had plenty of clouds out there. But watch the time lapse as we head into the afternoon. Earlier this afternoon, we started to see some clearing in the skies, and we will see clearing in the skies tonight, and that means chilly conditions, because without those clouds to keep in the sun, we'll be able to cool down quite a bit tonight. But here's the numbers from today. The high temperature was 68 degrees, 12 degrees below average, and our morning low of 47 was 11 degrees below average. So like I said, we're gonna start off chilly tomorrow morning. In fact, some places up in the hill country closer to Bernie will clock in the upper 30s tomorrow morning. Here in San Antonio, we'll be right at around 43 degrees, but we'll have plenty of sunshine tomorrow, so that means we'll warm up really nicely. You can expect a high temperature pretty much anywhere around Bexar County, right around 70 degrees. So a beautiful day tomorrow, and again, nothing but sunshine for your forecast on your Wednesday. Winds will still be from the northeast at about 5 to 10 miles per hour, so we'll continue to have low humidity. A beautiful day tomorrow, and we'll continue to see our nice weather trend at least through Friday. Take a look at these early morning temperatures. It's going to be great tomorrow morning, a little on the chilly side, chilly on Thursday morning as well. And then as we head into the weekend, we'll still be on the cooler side in the morning hours, but definitely not as cool as what we've seen the last couple of mornings. And then temperatures are going to stay pretty mild through the weekend as well, with highs really only starting to get back up into the uncomfortable warm range by Sunday. And Monday and Tuesday looks like we'll see 90 degrees again. There is one thing that I want to talk about in the 7-day forecast. By Friday, we start to see isolated rain work its way back in, and Saturday will likely be cloudy all day. So soak up the sun while you can, and again, with oak being a little bit less intense than the last few days, open those windows as well.
Well, the name is deceiving. Flushable wipes. Now that toilet paper is hard to find during this pandemic, more people are turning to alternative options. San Antonio water system knows this because they're having to fix more clogged pipes than usual. So here's a look at what you should and shouldn't be flushing down your toilet and why.
Flushable wipe is an oxymoron. There's no such thing. So unfortunately, manufacturers are able to make the claim.
So SAW's communications manager Ann Hayden says the burden to educate communities across the nation falls on utility companies trying to stop buildups and sewage spills. Toilet paper dissolves in our sewage system. But with panic buying leading to a shortage, people are starting to turn more often than usual to tissues, wipes, and even paper towel. Flushing all three of these is a big no-no. And if you do use these, just throw them in the trash.
But what happens with a wipe is it gets caught on a rough part of the pipe or on a branch, and then other wipes start catching on it. And then what happens is we'll get grease combined with it. And that's how you get huge pieces of things that look like concrete.
And with sewage emergencies come these guys, the SAWS crews that work day and night to keep your pipes clear.
I have a heavy meter leaks.
And this is what's left over from pumping for maybe almost 4 or 5 days.
We are all truly connected, and we have folks that in a fairly dangerous time to be out in public, they're out dealing with wastewater.
So throwing wipes in a bathroom trash can isn't just to keep your home safe from leaks. It's to keep your fellow community members safe during a deadly pandemic. And we thank all of those workers working hard day and night. Hayden says flushed bathroom wipes have become a huge issue in the past 5 or so years in cities all over the nation. SAWS does prevent pipe clearing every day, but again, the only way to fully prevent backups is by throwing those wipes in the trash. Stay with us. We'll be right back.
We are continuing our effort tonight to fight fear with facts as the coronavirus pandemic continues to impact communities across the globe. Infectious disease expert Dr. Ruth Bergeron from UT Health San Antonio, the Long School of Medicine, is back with us this week to help us get answers to our coronavirus questions. Dr. Bergeron, thank you very much for joining us. Let's start. What is immunity testing, and is it coming to San Antonio? It's our first viewer question tonight.
Sure. So, Steve, immunity is what happens when your body is battling a foreign invader, right? And basically, if you might remember from high school biology, you've got white blood cells that fight off foreign invaders and also antibodies, which are proteins. And you can kind of think of it as a cowboy trying to lasso a steer. The rope of the lasso is kind of like an antibody, and the steer is, well, the horns of the steer, like the pokey things on the outside of that coronavirus. And so when you get enough antibodies on that coronavirus, you can literally neutralize it. And that's what we're looking for with immunity, is making enough antibodies to neutralize the virus. Now, after that battle has happened and the virus is long gone, well, guess what? The antibodies stick around in the blood, and you can measure them. And we now have a test for that. And the test has been approved by the FDA, and we are getting it here in San Antonio. We expect it in the next week or two. It's going to be very helpful for us, Steve, because we'll be able to figure out how many people have actually been infected already and gotten over the disease. And that will give us a better sense of where we are at in our community with fighting off this virus.
So when we get this immunity testing, it's a very good thing.
Yes, we won't know exactly what it means right off the bat, because what we hope is that when we find the antibodies, that means a person had the disease, they recovered, and they're immune. We don't know for sure until the test has been around and we've tried this out, whether these people are truly immune or not. And of course, we want to take special precautions to prevent people from getting sick. So we're going to be very careful about easing the restrictions. But this is progress in the fight against this virus. We need this test. We are going to learn from it, and it's going to help us, I believe, figure out how we can reintegrate ourselves into a more normal existence.
Right, which is the next step in this whole thing. Talk about one of the questions we have tonight is from South Korea. Reported that at least 116 people initially cleared of the new coronavirus have tested positive again. What do you make of that, and what should we be listening for and reading for when we hear these kinds of reports?
Yeah, it shouldn't be too surprising, because we had heard about this already from China. People who had been cleared of the virus, then they tested them much later just to be absolutely certain. And then they found, when they put a swab up into their nose and then tested that swab with a reaction called PCR, they found fragments of virus. We have no idea if that virus that's found much later after the person has recovered, we don't know if that virus is alive or dead. And those could just be fragments of dead virions that are lying around. We have no evidence to date that such people can transmit the virus to others, but we learn something new every day with this virus, Steve. And so we need to watch, we need to study, and we need to learn. I think one of the lessons, one of the takeaways from this report is that we shouldn't be too much in a hurry to relax our social distancing rules, which we know are saving lives.
Next question, I think, also has to do with some of the blood studies that are being done in town. Do San Antonio medical and research facilities studying and using blood plasma of previously infected patients to treat new patients have any preliminary results yet?
Yes, so we're looking forward to having those results, but they really haven't been published. And we do hope that aggregate data from around the country where people are using convalescent plasma to treat patients who have active disease, we're looking for those data, and hopefully we'll see a publication soon, but there's nothing out just yet that can tell us whether that works. We hope, though, that folks who are recovering from the virus will think about the fact that their blood might be very helpful to someone else and might be able to help save a life.
Absolutely. All right, next viewer question. Does COVID-19 stay active in a deceased person? And if so, how long?
Yes, so clearly after a person dies, there's still going to be virus in that person's body, and it still could infect somebody, but it's not going to jump out of the person's body and onto someone else. In order for a person to get infected from the body of a deceased person, they would have to touch that body and then rub their own face or their eyes and get infected in that way. And they're very careful and well-written guidelines from both the CDC and the World Health Organization, providing advice for coroners and actually family member of deceased people about how to handle those bodies. And essentially, it's the same precautions that you would take around a person who is living. The deceased cannot cough, and so the mask is less of an issue, but you want to be careful about touching the body, and you want to be careful about washing hands and taking precautions of that nature.
All right, next question. Are hives/skin eruptions an emerging sign of COVID-19?
Boy, that's another example of how you learn something every single day with this pandemic. There are reports, and from credible places, including from the Mayo Clinic, including from dermatologists. And there's some small studies. I believe there was a study out of Italy where maybe about 20% of a group of 88 people that were studied had some kind of skin finding, red rash, usually on the trunk. It can look like hives. It might be blistering. But this seems to really be in the minority, and that finding was not reported in much of the data that came out of China. So this is something to be watched for and to be studied. What is the takeaway? I guess if you're somebody who doesn't normally get hives, and you have some new and unusual skin eruption, maybe in combination with feeling poorly, maybe you feel achy or a little fever, that could be a reason to trigger you to go online to that sanantonio.gov website and take the online survey and determine if you really should get tested for coronavirus.
Yeah, better safe than sorry. All right, if you recover from COVID-19, are there any long-term issues that stay with you?
So again, data to be determined. We need to study this disease and monitor what's happening. For sure, folks that have been in the intensive care unit, people who needed to be intubated and had terrible problems with their breathing and their lungs, it's going to be a while before those lungs recover to their normal healthy state. So at a minimum, someone who's had a long and rocky intensive care unit course will have recovery issues, both with respect to their breathing, also with respect to the deconditioning of their body after they've been lying in a bed in a coma for up to 2 weeks. And finally, this virus affects the heart, Steve, and we have more to learn about whether there will be any lasting effects on the health of the heart muscle after someone has recovered. But clearly, many people have recovered from mild disease and are walking around and doing just fine. So we need to keep a perspective on this. It's the minority of people that are going to get into serious trouble, and the minority of those that would have long-lasting effects from the virus.
Yeah, it's interesting you bring up the heart. I usually think of it as affecting the lungs perhaps more than anything else, and that could also be a long-term thing, correct?
Right. It clearly affects the lungs as well as the heart. The kidneys have been infected, and this is all because there's an overwhelming inflammatory response when the immune system gets activated in certain people. So every organ system can be damaged by that kind of overwhelming inflammatory response that gets triggered in some folks.
All right, every Tuesday, I love to give you the final word in what we're going to talk about, and I'm just going to lob this one up to you, Dr. Bergeron. Any good news to share tonight?
Yeah, I think the good news is that San Antonio took the message seriously. San Antonio has continued to take the message seriously. We have clearly flattened our curve, and now we need to show our endurance and our stamina. And don't give up. You're saving lives every day by staying home. Progress is being made with treatment. We have remdesivir, that's an antiviral that's being studied. We have convalescent plasma. We have new tests that are on the way and better tests. We're learning how to diagnose the disease faster so we can isolate people more quickly. We're going to learn about how many people have already been infected and gotten over the disease. That's going to help us figure out how we get people back to their normal lives. We're inventing new things. Like a new mask that's even better than the N95 mask, something that was invented right here in San Antonio in our own university hospital. So all of these are bright spots on our horizon. We need to hang on to those bright spots. We need to hang on to the light in what is otherwise a very difficult and challenging time in our country and our world.
Love that message. Dr. Ruth Bergeron from the Long School of Medicine at UT Health San Antonio. Thank you for joining us.
Happy to be here.
We'll be right back.
New tonight, President Donald Trump says he's halting U.S. payments to the World Health Organization pending a review of its warnings about the coronavirus in China. The president says the outbreak could have been contained at its source and spared lives had the UN Health Agency done a better job investigating reports coming out of China. This announcement comes as President Trump faces criticism over his handling of the pandemic, with some saying he downplayed the crisis. The U.S. funds $400 to $500 million to the WHO every year. Turning to tonight's top stories, a federal appeals court is allowing what's known as medication abortion to go back into effect here in Texas during an ongoing legal challenge. The ruling is a win for abortion's rights supporters in a fight that began last month with an executive order from Texas Governor Greg Abbott. He ordered non-essential surgeries to be canceled in an effort to preserve personal protection equipment during the pandemic. He labeled abortion non-essential. Now, medication abortions are often performed early in a pregnancy and consist of a patient taking one pill at a clinic and a second pill 2 days later, typically at home. Abortion providers say no PPE is used for these procedures. Here at home, a group of biomedical engineers at JBSA Lackland are changing up their daily routines in an effort to get face shields to healthcare workers who desperately need them. Typically, the engineers working in the medical labs at the Air Force Postgraduate Dental School spend their days creating surgical guides and various medical devices used by residents at BAMC and Wilford Hall. Now they've developed a way to 3D print components of face shields, which can be easily pieced together and shipped off to providers.
We were tasked with designing and printing face mask shields, the holders, and we came up with a design that allows printing of the rigid portion that holds clear photocopy paper, and using parts that you can find readily, creating face masks.
Right now, the lab is capable of producing 25 face shields every 10 hours. The drop in our financial markets has caused many people to worry about their retirement plans or 401ks and savings. RJ Marquez spoke with a finance professor at UTSA about what you need to know before you think about moving your money around. It's tonight's Money. It's personal.
Because of this pandemic, there's been a virtual shutdown of economic activity.
Dr. Karen Banat, the department chair and professor of finance at UTSA, understands the fear people might have with the current state of the market. Those saving for retirement are probably not feeling too great right now. But Banat says those anxieties shouldn't cause you to do something you might regret.
I think that if you have stocks, it's a good idea not to sell right now. And the best thing you can do is really not look at your 401k plan. Close it.
Banat says while people might be tempted to take money out from their 401ks, in fact, you should be thinking about doing the opposite.
Evidence shows that during any time period when returns are very low over a particular time period, it is very likely that you'll have excess returns over the next 3 to 5 years. So that's really the time to buy and not the time to sell.
For people with money or savings in the bank, Banat advises to keep it there. He said this is not like the financial crisis of 2008. Banks are stable and the Federal Reserve is pumping money into the system.
This is really a health pandemic, as we all know, and it's not because of economic imbalances. So the government has stepped in. They are aggressive on finding cures and vaccines. They have a stimulus in place.
The coronavirus is causing a huge ripple effect in our economy. Businesses have closed and a record number of people have lost their jobs. but there is hope for workers that they will soon be able to get back on their feet more quickly than during other economic crises.
If you have an extended economic crisis or a recession of the type that we had last time, it takes a while for that to play out. 3 years, 4 years, 5 years.
But not as optimistic we can weather the financial storm and get back to normal.
As things start to open up, we will see increased economic activity, and it is painful, but my thought is that things will recover more quickly than they did in 2008.
For The 9, RJ Marcus.
San Antonio is home to medical and academic research institutions, an innovative private sector, and an active military missions. And they are all developing innovative technologies to fight COVID-19. Tomorrow night, we are holding a virtual town hall with Mayor Ron Nirenberg and bioscience experts about the solutions they're exploring. And we want to know what questions you might have. You can submit them right now on KSAT.com, and our panel of experts will be answering your questions during a live broadcast at 6:30 during the news at 6. We'll be live streaming the virtual town hall until 8 p.m. on KSAT.com.
What's up, guys? Time to check out some stories that are trending today on KSAT.com, and we start with a heartwarming story of a San Antonio infant who was able to visit his great-grandmother on Easter Sunday. So the family posted this video or a picture, and it basically went viral across the city. Mary Lou is her name. She is the great-grandmother, and Baker is her grandson. What they did was they were able to see each other through a window, of course, because of the coronavirus pandemic. They shared their story with us on KSAT.com. It's pretty cool. Mary Lou has lived on the South Side for 60 years, always gets to see her family on Easter, but of course, because of the current situation that we're in, was not able to this time, but they still managed her family to take her great-grandson to stop by. And again, it's one of those examples of local families and basically everyone around the country staying in contact with loved ones during these tough times, and especially during the holiday weekend. So pretty cool stuff there. You could check out Mary Lou and Baker's story on KSAT.com. All right, moving on. Matthew McConaughey, you gotta love this guy. He is always up to something. Well, he is now basically playing a character called Bobby Bandito. Okay, so what he did was he took to Instagram, posted a video of himself as Bobby Bandito, and he's basically telling us how to make a face mask with a bandana and a coffee filter. So yes, Matthew McConaughey, the Minister of Culture at UT, the Minister of Culture for the city of Austin, is now apparently the Minister of helping us limit the spread of the coronavirus pandemic. It's a pretty cool video. It's of course been seen by thousands of people on Instagram. And if you love Matthew McConaughey, this is like the perfect thing for you to check out. Matthew McConaughey still keeping us entertained as Bobby Bandito, even during these difficult times. Check out that story on our website. All right, last story of the day, probably my favorite one here. This story comes to us from Pennsylvania, where a 93-year-old woman, she went viral because she posted a sign. So she was at her window, came up with a sign that basically said, "I need more beer." Well, don't we all? Her name is Olive, and in response to this sign that she posted that went viral again, Coors Light has now sent her 150 cans of cold beer for Olive to enjoy. It is a great story of perseverance during these difficult times. No, I think it's great stuff there. Obviously, Coors Light stepping up. You know what? Make this 93-year-old woman smile. There's now pictures of her online and videos showing her with several packs, 24 packs, 12 packs of the Silver Bullet Coors Light. Nice job by them stepping up, and hopefully Olive is enjoying herself on this day. All right, guys, if you want more stories from us, all you got to do is go to KSAT.com. You can get all the latest stuff there. That is it for our trending segment. You guys have a good one.